My vision before cataract surgery was interesting. 20 plus years ago, I had a technology called Intacs, which involves using these tiny little segments that get placed in your cornea, and they flatten out your cornea very similar to the way LASIK surgery does. So oftentimes you get asked the question, well, why didn't you just have LASIK? Because I was nearsighted and still had my reading vision, so I was young 30s, and decided at that point that, this Intacs procedure is really cool because it's reversible. And LASIK at the time was starting to get more popular, but it was like, wow, what an incredible technology that I actually got involved with and did myself. And I'm like, really, there's no downside to this, because if for some reason it doesn't work like I thought, the segments can be removed and life goes on. As a super busy surgeon and medical director, I found that I'd have to squint a little bit to see everybody down the hall, and couldn't tell who that was, but I knew it was a person. But all my work up close was fine. So I could read in between rooms doing patients. When we operate off of a microscope, so I could adjust the settings to have it perfect for that. So I kind of went that way, and I realized that when I do stop operating someday, for a lot of personal reasons, I'm definitely going to have something done, because I have one eye that kind of sees great here, one there, and I still need glasses for far away. So that's kind of the story of my vision prior to the surgery. So then moving into the technology and the surgeon and those sorts of things, I have a simple mnemonic, and it's sort of STC. Surgeon, number one. Number two, technology. Number three, center. Where am I having the surgery done? So as far as surgeons are concerned, Dr. DeRojas, who took over in my position as medical director, is an incredible surgeon. I've actually watched him do surgery. Him and I, along with another partner, Dr. Matthews, all three of us together would always talk about technologies, talk about cases, and those sorts of things. And for that matter, there were probably 5 surgeons here, I think, at Center for Sight now with me gone, that I'd be comfortable any one of them doing my surgery. And there's probably another 40 across the country. So it speaks a lot to Dr. DeRojas and the detail that he went into with me with. I know, number one, he's a fantastic surgeon hand-wise, but two, he really looked at all sorts of little things. Like, I still have segments in my other eye. So do I take those segments out preemptively? Do I leave them in? Do I do just one eye? What technology do I use? So we really spent a lot of time for months prior to my retiring deciding what would be the best technology if I decided it. The second piece is the technology. So being, I guess you could say, a little bit greedy, from the standpoint where I really wanted to have not only excellent distance vision, I also have been accustomed to not wearing reading glasses. So I really wanted to be able to read most things without my glasses. So my goal with the surgery was, number one, this will be great, I'll get it done, I'll never need cataract surgery because I had my natural lenses removed. And two, I really wanted to have excellent distance vision, because being involved in a lot of physical fitness type things, I really wanted to see great far away. But at the same time, I still wanted to maintain a very high level of good near vision. I am a deacon at church, so I do homiletics, meaning where you give sermons and, you're reading from the gospel. So anyway, so again, sort of a little bit greedy, from the standpoint that I really wanted to try to maintain as much vision as possible. Now, in my role as a surgeon, I've had a fantastic opportunity to work with all the different technologies, all the various multifocal technologies, light adjustable lens technology, and specifically, and I kind of hold it in its own category, this Odyssey lens, what we call it, as a full range of vision lens. It truly is a different technology. Why can I say that? I was one of the first, if not the first. There's this little argument between a few of us across the country who put the first one in. But arguably at the time, I put as many or as more of these lenses in than anybody in the country. So I had a lot of experience with it personally and seeing how great our patients did. And not only that, Dr. DeRojas, Dr. Matthews, and myself were involved in 2 different studies at the time. So we got to really look at it in a super controlled way, really analyze the data. And the data was just incredible, from the standpoint of 95% of patients being independent of glasses, less than 2-3% of people having any kind of real problems with the nighttime stuff that you oftentimes hear with multifocal lens technology.
We've been waiting for technology that can give us that confidence as surgeons and as patients to go for it. So I was confident that I could give him a good surgery, but I want to make sure he's going to be happy. So we discussed it, and he told me, I am so confident in this technology. I've implanted more of these lenses, other than you. I've implanted more of these lenses than anyone. Me and him have probably implanted, I'm up there. And I have that confidence in the lens, but I want to make sure he was 100%, and he was. And we had a lot of different options, and he chose that lens. He chose this surgery center, and he didn't wait too long. Like, I think it was within a month of his retirement, he's back in the ASC. So it was an incredible honor to do it, and I think it was, well, I know now. I thought at the time it was the right decision. There's always the little shadow of like, he's my good friend, he's my colleague, and we're doing something that hasn't been done before. No one's ever done this lens, or even a similar lens potentially, but definitely not this one, in a patient with that irregular cornea, with the Intacs, and in someone this young with the irregular cornea. So it was kind of a first, and I'm doing it on my good friend, so stakes are a little high there. So it's not, it's something that I really had to think about. We both thought about, but we went for it because we believed in the technology, we believed in the process. And I'm just super happy that we got him to what he wanted, and it couldn't have gone better. It was already kind of bizarre to see him in the lane. So when I was seeing patients and he was just sitting there, I'm like, shouldn't you be in this chair? But so that was cool. And we started talking about that, and he was actually in scrubs because he was still a doctor here. So that was already interesting. And then when it came time to surgery, I guess, I had already operated on a few people from the surgery center, so I kind of knew what that was like to operate on people you work with. But it was different to operate on someone who, I worked so closely with, was my really good friend, and not only that, is my really good friend. He was actually, when I first started, because he's a little older than me, not much, but he really inspired me as a surgeon. And he was a mentor to me. In the beginning, coming to a practice like this, when you're young, really young and out of training, it's overwhelming because we do so much volume, and it can be a lot. So having someone like him, a confidant, to guide me through it was really powerful and really helped me get through it, and made me who I am. So it was just an incredible honor to be able to do his surgery, and sort of almost like a thank you. So it was a little otherworldly, I would say. It gives me even more confidence than I had before. I've already, we've already had a tremendous confidence in the lens, but it's like, I think of it now, I've had LASIK before. I had LASIK when I was a resident, and I saw how good of a procedure it is and how safe it is, and I asked someone to do the LASIK for me. They're a very famous doctor there, Dr. Donenfeld. I'll just name drop him, he's great. But when I had that was really awesome, because when I talk to patients, I perform LASIK as well, and when I talk to patients, I can tell them I had it done, and I can tell them this is what I faced. I had some halos a little bit in the beginning, a little bit of dry that I treated. Now I'm great. I love it. Wouldn't go back. So that's really important for patients to hear that. They want to know that you're not just selling them something that you wouldn't do yourself, or that you wouldn't do to your friends or your family members. That's super important. And anyone who does that is probably just a salesman, I would call it, and not really true to their word. So now I can truly say that I would put this lens in my friends and family, my deepest friends and family, I would. And so it does change the way I talk to my patients. Even if I don't directly mention this specific patient, a specific case, I don't necessarily mention it, but I think it comes off in how you talk to patients, and how much you believe in it, and how much you really understand the nuances and the ins and outs of not just from the surgeon's perspective, but from the patient's perspective too.
I just had complete confidence. I had complete confidence in Dr. DeRojas. I know the surgery center and the surgery center staff, they're all outstanding. They took great care of me. And I don't think my heart rate was ever above 55. I didn't even get an IV. So I had no Versed, no relaxing medicine, even oral medication. I just had numbing drops and did a little of my meditation, and I knew I was in fantastic hands with Dr. DeRojas in our surgery center. And it was flawless. I mean, the procedure probably took 5 or 6 minutes. It was actually pretty cool, looking at the light, and you can kind of see the little rings of the implant when it's going in my eye. And being a surgeon, having done thousands and thousands of procedures, I kind of almost knew exactly, okay, I know he's doing this right now. And so it was a lot of fun. It really was. My vision from day one of the first eye, and I had my second eye done the second day, changed my life immediately. I mean, I immediately was seeing within hours, seeing at distance pretty well. Reading vision was okay. This is day one of the first eye. And then the second eye, day two of my first eye, day one of my second eye, I'm seeing beautifully out of my first eye, distance and near, and just a teeny bit fuzziness in the second eye that I had done hours later. And by day two, when I came in for the visit, I'm seeing 20/20, maybe minus a letter or two, and same thing with the near vision. And the vision has just been great. I've been aggressively being a great patient, doing all the drops, my antibiotics, my anti-inflammatories, still working super hard to make sure I'm not only just treating dry eye as much as optimizing my ocular surface like we preach to every one of our patients. And Dr. DeRojas is a great coach. He goes, all right, man, you doing it? I say, yes, sir. We're good to go. And it's been wonderful. One other point to also mention, with a lot of these multifocal technologies, we talk about, unwanted side effects, rings around lights at night, those sorts of things, absolutely minimal. I think it was actually, interestingly, you guys will think I'm crazy, I had hip surgery in the midst of all this, and I had my one hip replaced. And so I didn't get to be on the altar for the last couple of weeks. So I kind of sat as like a regular parishioner in the congregation, if you will. So I'm sitting in the back and seeing everything beautifully. I'm reading from my little missalette and everything is great. And then when I noticed the little candle that we have up on the altar, I saw maybe just a little glow around the candle. And same thing like with lights at night. I drove last night, actually it was the first time. I actually had to go to Orlando and pick up my wife and drive back. But driving back, seeing everything beautifully, and just what I would call, everyone describes these things a little bit differently, like a little bit of glow around the lights. And interestingly, with my Intacs and some of the dry eye and those sorts of things, even when I was wearing prescription glasses before the surgery, I had worse problems from headlights and things of that nature. And there's no cataract, it was just, the nature of all those brutal lights on those cars these days, as well as some of the issues from the Intacs and all. So so it's just, I really don't know what else to say. It's just been outstanding all around. I can say it from the standpoint of an academic clinician, if you will, having been involved in the studies. More importantly, a practicing clinician, having put in over 1,000 of these lenses. I think at the time being close to one of the, at least in the top 5 providers in the country in terms of the amount of these lenses that I've put in patients. And in conjunction with doing those studies and doing a lot of my own post-operative care on these patients, getting to see patient after patient and talking to hundreds of patients about this, just had no doubt about it that this is what I'm going to do. And it's like, number one, assuming that you're a good candidate, because there are certain things that make you a non-candidate for any particular technology. But assuming good candidacy, it would be the number one technology that I recommend to everybody. And the last point of that, which is a little bit of an extra part of that, again, with these advanced technologies that we'll call them, there are a lot of different things that will say, you know what, in your particular case, we don't want to use an advanced technology. We'll just call it in that broader category, because of it could be some mild dry eye, it could be some issues in the back of the eye, etc. That with this technology, with the Odyssey technology, because of how advanced it really is, without getting into the optics and all those sorts of things, it really broadens the range of patients that we're able to use it in. So it's such a wonderful technology, and I've talked to dozens of doctors across the country where they've asked me about my experiences. We've trained them up and they're using it and having the same experiences. So just all around, surgeon, Dr. DeRojas, the technology, Odyssey, Center for Sight, in our surgery center, all kick butt.